Hello, Gemini. I am Carl Raven Aureliano Pindihito, a first year radiologic technology student from Southwestern University, FINMA. I am here for a mock interview as our final exam in purposive communication. Please ask me 10 random questions about my understandings of radiologic technology, basic patient care, safety, and my motivation for choosing this career. I will do my best to answer honestly and clearly.
That sounds like a great plan, Carl Raven. I'm here to help. I'll ask you those 10 questions covering your understanding of radiologic technology, patient care, safety, and your motivation. Just take your time and answer honestly. Ready when you are.
I'm ready for the 20 questions.
Excellent, Carl Raven. Let's begin with the first question. What is the primary function of a radiologic technologist? In simple terms, what is our main job?
I think the primary function is to safely create a diagnostic medical images like x-rays, CT scans, or MRIs of a patient's body. And I think these images are essential tools that doctors use to accurately diagnose and treat illnesses or injuries. That's my answer.
Great job, Carl Raven. You perfectly captured the main duty of a radiologic technologist. Now, let's move on to the second question. Can you name 2 different imaging modalities, types of scans, that a radiologic technologist might perform besides a general X-ray?
I think 2 common modalities are computed tomography scanning and magnetic resonance imaging, which is MRI. Others include such as ultrasound or ultrasonography, mammography, and nuclear medicine. That's it.
You got it, Carl Raven. CT scans and MRIs are both excellent examples. It's also great that you mentioned ultrasound, mammography, and nuclear medicine, showing a broad understanding. Moving on to the next question. Why is it important for a technologist to clearly explain a procedure like an X-ray to a patient before starting?
I think explaining the procedure is crucial because it helps secure the patient's cooperation during the exam, like knowing when to hold their breathe, and helps reduce their anxiety by letting them know what to expect.
You hit the nail on the head, Carl Raven. Clear explanations improve cooperation and reduce anxiety, which is vital for both the patient and the imaging outcome. Great answer. Moving on to the fourth question. Imagine a patient is very nervous. What is one simple thing you can do or say to help make them feel more comfortable?
I would use a calm, reassuring tone and say something like, I understand you might be nervous, but I will be right here with you in this examination and diagnostic.
That's a great approach, Carl Raven. Using a calm, reassuring tone and letting them know you'll be with them can make a big difference. For the fifth question, what is the single most important principle we use to minimize radiation exposure to both the patient and the technologist? Hint, it's an acronym.
I think the most important principle is the ALARA, which stands for as low as reasonably low. This means we use the lowest dose of radiation necessary to get a high quality diagnostic image.
That's exactly right, Carl Raven. ALARA, or as low as reasonably achievable, is this cornerstone of radiation safety, and you explained its meaning perfectly. Now, for the sixth question, name one specific piece of personal protective equipment, PPE, that a radiologic technologist might wear during performing a portable X-ray in the operating room or on a ward.
A technologist would wear a lead apron or lead shield to protect their body from scatter radiation. They might also wear surgical mask, gowns, and gloves, but the lead apron is specific to radiation protection.
Precisely, Carl Raven. A lead apron is a critical piece of PPE for radiation protection. And you rightly pointed out that other PPE may be necessary depending on the situation. Well done. Now, for the 7th question, why must a technologist check a patient's identification multiple times before starting a procedure?
This is a mandatory safety called patient verification to prevent medical errors. It ensures that we are performing the correct procedure on the correct patient, and so on and so forth.
Yes, patient verification is vital, and you're absolutely right that it helps prevent medical errors by ensuring the right patient gets the right procedure. Perfect. Now, for the 8th question, what is the most interesting or exciting thing you've learned so far in your radiologic technology course?
I wanted a hands role in medicine where I could blend my interest in technology and physics with direct patient interaction. Being a rad tech offers a critical thinking and deep understanding about patient safety.
That's a great answer, Carl Raven. It's wonderful that you found a field that combines your interest in technology and physics with your desire for direct patient interaction and a commitment to safety. For your 9th question, what is the main reason you chose to study radiologic technology instead of another healthcare profession?
It really wasn't my decision to enroll in radiologic technology. It was a last minute decision to enroll in this course because I was recently an veterinary medical student and currently facing financial struggles, and the least tuition that could offered is the radiologic technology department.
Thank you for sharing that, Carl Raven. It's understandable that circumstances can change our paths. Despite the initial decision being last minute, how do you feel about continuing your studies in radiologic technology now? What are you hoping to achieve in this field?
I'm hoping to achieve in this field is to I'm hoping to get more understanding from this and acquiring a lot of knowledge so that I will apply this kind of understanding in the future.
That's a wonderful goal, Carl Raven. Wanting to learn and acquire knowledge to apply in your future career is a great mindset to have. Finally, for your 10th question, in 1 or 2 sentences, how do you see yourself contributing to patient care after you graduate and become a licensed technologist?
I plan to contribute by providing accurate, high-quality images quickly and by creating a positive, compassionate experience for every patient during a stressful time in the hospital.
Certainly, Carl Raven. I'd be happy to give you feedback again. Overall, you did a commendable job with the mock interview. Your understanding of radiologic technology and basic patient care shone through in your responses. You articulated your points clearly and provided good examples, especially when discussing ALRA and the importance of patient identification. One area where you could really shine even more is by elaborating on your motivation question. Sharing a specific story about what inspired you to pursue radiologic technology, despite the initial change in plans, would really connect with the interviewer. Do you want to talk through that a bit now?
I know I'm good, thank you.
You're welcome, Carl Raven. I'm here to help with anything else comes up.
Thank you, Gemini.
You're welcome, Carl Raven. I'm here to help if anything else comes up.